Many folks believe health checkups are always beneficial, but what if I told you that after a certain age, some tests could actually jeopardize your well-being? It sounds odd, I know, but the reality is, not every screening is safe. In fact, some common tests for older adults can lead to false results, unnecessary worry, and risky procedures. This isn't meant to scare you. It's a truth more doctors are starting to recognize, especially for patients over 70. The medical field is realizing that one-size-fits-all testing can cause more harm than good as we age. In this video, we'll dive into 5 specific health checkups that seniors might be better off skipping, tests that even seasoned doctors often avoid for themselves. We'll look at why these tests are so frequently suggested, the hidden risks they pose, and safer alternatives that keep you informed without putting you in danger. You deserve care that respects your age, your body, and your quality of life. If you're someone who values your health but wants to avoid being overtreated, overmedicated, or overwhelmed by the healthcare system, this video is for you. We're not here to frighten you. We're here to equip you with knowledge, confidence, and a clearer view of what truly supports your health after 70. Let's get started. Number 1, the colonoscopy risk. Colonoscopy is often seen as the best way to prevent colon cancer. But after age 70, especially for those without symptoms or a family history, this test can quietly become more harmful than helpful. A screening that was life-saving in your 50s or 60s can at a certain point bring unnecessary risks, stress, and even hospital stays. Why? The procedure isn't simple. It requires full bowel prep sedation and a scope inserted deep into your intestines. That's tough enough for younger adults. But for seniors, the risks rise sharply. The bowel prep alone can cause severe dehydration and electrolyte imbalances, which are dangerous for older adults. The sedatives used can also linger longer in an aging body, causing confusion, dizziness, and a higher chance of falls. Even more concerning, many seniors over 75 face follow-up surgeries or treatments after a colonoscopy find small polyps that might never have caused harm. These slow-growing abnormalities often take 10 to 15 years to become serious, and for someone in their 70s or 80s, those years may not matter. Yet finding them sparks fear, leading to biopsies, repeat scopes, or even partial bowel removals, all in the name of prevention. When the risks outweigh the benefits, prevention can turn into harm. Here's a story I'll never forget. My friend Frank, 82, active and sharp, was convinced to get a routine colonoscopy despite no digestive issues. During the prep, he got severely dehydrated. After the procedure, he was groggy, fell at home, and broke his hip. That one test led to months of rehab, medical bills, and stress. And guess what? The scope found nothing. This isn't about blaming doctors. They're doing what they're trained to do. But medicine is changing, and we need to change with it. If you're over 70 and have no symptoms, it's okay to say no to a colonoscopy. Safer, non-invasive stool tests are now available, which are easier and effective for many. It's about weighing the true cost, physically, emotionally, and financially, of putting your body through something that may not help. We need to stop thinking more testing always means better care. After 70, better care often means fewer procedures and smarter choices. You're not ignoring your health by being cautious. You're respecting it. Number 2, the full body scan mistake. The idea of a full body scan sounds appealing. A machine scans you from head to toe, catching every hidden issue before it becomes a problem. Sounds like smart prevention, right? But for seniors over 70, this can be more harmful than helpful. While full-body scans seem proactive, they often trigger a chain of fear, invasive tests, and unnecessary surgeries that can shorten your life, not extend it. Full-body CT scans and MRIs aren't typical screening tools. They're designed to detect everything, including harmless abnormalities that would never affect your health. These incidental findings can become a source of worry. A small nodule here, a shadow there, and suddenly you're caught in a cycle of follow-up visits, biopsies and specialists chasing something that might never have mattered. Why does this matter more after 70? Because an older body doesn't recover like it used to. A biopsy that was simple at 45 can now cause a collapsed lung, infection, or weeks of recovery. Even lying still for an MRI can be exhausting or painful for older joints. And the emotional toll is real. Seniors often worry about what might be, instead of enjoying the health they have. Take Louise, a 78-year-old I met at a health seminar. She was vibrant, walked daily and felt fine. But at a health fair, a mobile clinic offered her a discounted full body scan. They found a tiny kidney lesion, so small it likely would have never caused issues. But the word lesion sparked panic. Within a month, she was in surgery. The aftermath, months of recovery, less energy and complications that lingered, all for something that might have stayed silent forever. Medically, this is called overdiagnosis. Emotionally, it's unnecessary fear. Financially, it's costly. Full body scans are rarely covered by insurance, leaving seniors to pay out of pocket, thinking they're buying peace of mind. But often, they're buying stress. Responsibility at this age means trusting your body more. Listen to how you feel, not just what machines say. Not every shadow on a scan deserves your worry or energy. If you're finding this video helpful, please comment number 2 below to let me know you're here. And if you haven't subscribed, hit that button and turn on the bell so you don't miss our videos. Your support helps us keep creating content to inform and inspire you. Number 3. Overused cardiac stress tests. For years, treadmill stress tests have been a go-to for detecting heart disease in older adults. The idea is simple. Push your heart and see how it handles pressure. But after 70, this test can backfire in ways many don't realize until it's too late. What was useful in your 50s or early 60s becomes risky and questionable as you age. Cardiac stress tests in seniors often produce false positives, results that suggest a heart problem when your heart is actually fine. This happens because aging changes your body. Arteries stiffen, blood pressure varies, and heart patterns shift naturally. These aren't always signs of disease, but the test flags them as problems, triggering fear and more tests. This can lead to angiograms, catheterizations, or even stent placements and bypass surgeries, all with serious risks. For seniors, these include bleeding, kidney damage from contrast dye, or dangerous blood pressure drops. Surgeries are harder to recover from, and complications pile up. What starts as a treadmill test can land you in a hospital bed, wondering how it happened. Take Frank, a 74-year-old retired bus driver. He had no chest pain, no shortness of breath, just a routine checkup where his doctor ordered a stress test just to be safe. The results were borderline, leading to a cardiologist referral. 3 weeks later, he had an angioplasty for a blockage that wasn't causing symptoms. A month after, he developed a severe infection at the catheter site, ended up in the ICU, and spent 6 months in and out of rehab. His quality of life hasn't fully recovered. Was that treadmill worth it? Many heart specialists and geriatric groups now advise against routine stress tests in seniors without symptoms. If you're not having chest pain, shortness of breath, or unexplained fatigue, the test often brings no benefit and real harm. At this age, the goal isn't to live forever, but to live well. Psychologically, checking your heart feels reassuring. It's the core of life. But healthy aging means focusing on how you feel, not chasing every potential issue. Instead of treadmills, prioritize daily walks, balanced meals, staying connected, and managing stress. Those truly support your heart after 70, not machines or tests meant for younger bodies. Wisdom means saying no to unnecessary tests and understanding that not every test is a gift. Sometimes skipping a test is the most life-affirming choice. Number 4. The risks of routine. Colonoscopies. Colon cancer is scary. It can sneak up without warning, and by the time symptoms show, it might feel too late. That's why colonoscopies have been hailed as a key preventive tool. But after 70, especially without symptoms, the risks can outweigh the benefits. And for some seniors, this test can do more harm than good. The procedure requires full sedation, which is riskier for older adults. Your liver processes drugs more slowly as you age, and your brain is more sensitive to sedatives, increasing the chance of post-operative cognitive dysfunction, lingering confusion, memory issues, or brain fog that can last weeks or months. Then there's the bowel prep, drinking large amounts of strong laxatives to clear your system. For seniors, this can cause dehydration, disrupt electrolytes, and affect kidney function, leaving you physically and emotionally drained. It can also lead to dizziness or falls, especially for those living alone. Falls during colonoscopy prep are more common than people think. The bigger issue is the time horizon. Colonoscopies detect slow-growing polyps that might take 10 to 15 years to become cancer. If you're in your 70s or 80s with prior clean screenings, the odds of those polyps turning into anything dangerous in your lifetime are extremely low. Yet the risks of complications like bleeding, perforation, or drug reactions rise with age. Take Helen, a 78-year-old retired school teacher. She had clean colonoscopies at 68 and 73. But at 78, her doctor suggested one more, just to be safe. During the procedure, her colon was perforated, a rare but serious issue. She needed emergency surgery and spent a month in the hospital. She survived but lost energy and independence. She wishes someone had warned her the test might not be worth the cost. Why does this happen? It's partly habit. Doctors think what worked at 50 still works at 75, but aging changes the math. Fear of cancer drives decisions, but it can overshadow what matters, staying mobile, sharp, and emotionally well. Focus on symptoms like unexplained weight loss, abdominal pain, or blood in your stool. If those are present, testing makes sense. But without symptoms, and with a good screening history, routine colonoscopies may be unnecessary and risky. Being informed means understanding trade-offs, not just following what's supposed to be done. Your body deserves care, not risks with little benefit. Number 5, overuse of cardiac stress tests. Heart disease feels like a hidden threat. One day someone seems fine, the next they're gone. That's why cardiac stress tests, like treadmill or chemical tests that check your heart under pressure, are so common for those over 70. But for many seniors without heart symptoms, these tests can cause more harm than good. The idea sounds comforting. Walk on a treadmill, monitor your heart, and catch problems early. But aging changes your cardiovascular system. Mild artery stiffness, some plaque, or slower recovery are normal. Stress tests can misread these as issues, leading to false positives and a cascade of tests like angiograms or stents. These carry risks: bleeding, stroke, or kidney damage from contrast dye, especially in older adults with fragile vessels or weaker kidneys. One test can lead to another, and soon you're facing interventions for a condition that wasn't causing problems. Take Thomas, a 76-year-old grandfather from Illinois. He felt fine, walked daily, played with his grandkids, and had no symptoms. At a checkup, his doctor suggested a stress test, just to be sure. It showed a minor issue, leading to a catheterization that found non-obstructive plaque. They placed a stent anyway. Afterward, Thomas had complications from blood thinners, internal bleeding, and 3 months of hospital stays and recovery. All from a test he didn't need for a non-urgent issue. Why does this happen? Fear of missing something drives it. But at this stage, quality of life matters more than chasing every potential problem. Many cardiologists now advise against routine stress tests in seniors without symptoms. They don't reduce heart attacks or mortality and can cause harm. Focus on symptom-based care. If you notice fatigue, chest pressure, or a racing heart during activity, get checked. But if you're feeling steady and active, your body is telling a better story than a machine. Aging wisely means observing, not over-intervening. Protect your energy, clarity, and dignity, not fighting every possible issue. Growing older doesn't mean becoming helpless. It's when you're wise enough to question the system and ask, is this right for me? In a world pushing more tests, more screenings, more pills, the bravest choice is often doing less, not out of neglect, but from understanding your body, values, and goals. Healthcare after 70 shouldn't be a one-size-fits-all routine. It should be a conversation about what matters to you, how you want to live, and what risks you're willing to take. Following protocols meant for younger bodies can steal your energy, peace, and even years of life, not because doctors mean harm, but because the system often prioritizes disease over health. If this video gave you a new perspective, it's done its job. Saying no to certain tests isn't ignoring your health, it's being intentional. You're weighing benefits against burdens, recognizing that not every test brings clarity. Some lead to overdiagnosis, anxiety, and unneeded treatments. So take charge. Talk openly with your doctor. Ask if a test will truly change your outcome or just add paperwork. Value your time, energy, and comfort. They're precious. You've earned the right to live on your terms, thoughtfully, empowered, and focused on meaning, joy, and connection. Thank you for watching. Please leave a comment below sharing one thing you learned and how you'll use it. Your thoughts inspire us. If you found this helpful, like, subscribe, and share. Your support helps us create content to inform and inspire you. See you in the next video.